Well, every 40 seconds in the U.S., someone suffers from a stroke. And this American Heart Month, we've been talking about heart health and stroke awareness as well. And today we're joined by Dr. Peter Soden. He's a vascular surgeon with Brown Surgical Associates. Doctor, thank you so much for taking the time today.
Pleasure to be here.
Doctor, the first question I want to ask you to explain to our viewers, what are the signs of a stroke?
Typical signs are facial asymmetry, speech problems, loss of vision in one eye, or one-sided motor or sensory deficits.
Doctor, what have you been seeing in terms of COVID's impact on people's heart health? Are people still seeking the treatment that they need during this time, or has COVID sort of spooked folks into maybe staying at home when they really shouldn't?
Yeah, the pandemic has certainly made people afraid to seek help for other medical conditions, and we see that across the board, including with stroke.
And what does that mean in terms of people's long-term prognosis? Can that be really damaging if someone needs treatment and is potentially too afraid to go out because of COVID to seek that treatment?
Certainly there are many conditions that present in an acute nature that need either timely medication or intervention by procedure or surgery to help improve their prognosis.
Yeah, I wanted to ask you about a specific kind of treatment called TCAR. I understand this is pretty cutting edge, so can you explain to folks at home what is TCAR?
Sure. So TCAR stands for transcarotid artery revascularization, and it's a new way to deliver a carotid artery stent across a narrowing in the carotid artery for patients who either have had a transient ischemic attack or stroke or are at high risk of developing one based on the narrowing in that carotid artery.
Doctor, can you just describe for people what actually happens when they undergo this procedure?
Sure. So it involves a small incision just above the neckline, which is used to insert a sheath into the carotid artery. That sheath is what you can deliver the stent through, in addition to providing the flow reversal, which is the protection system that TCAR uses to protect the patient from suffering any stroke during the procedure itself.
Doctor, is there anything else that you'd like to add or let people know today?
Patients and their loved ones don't neglect other aspects of their health. And so if they have an acute need for medical attention, they should not delay that. They should seek medical care as they would outside of COVID times.
Dr. Peter Soden, thank you so much for taking the time.
Thank you very much.